Are you doing the correct exercise? A common question we ask people, usually on their first assessment, if they've had treatment in the past, as to what type of exercises they were prescribed by the physiotherapist, and what were they aiming to do. And quite frequently we get quite a blank expression that people really have either can't remember, obviously didn't spend a whole lot of time doing what they were prescribed, or they really didn't make much of an impression. So usually we think it's quite important that people understand, if they're given a home exercise, what it's aiming to achieve. How do you measure if it's achieving what you want it to do? And ultimately, is it beneficial, or is it just being a busy fool passing time? Now, sometimes people get a little bit frustrated that physiotherapists always prescribe home exercise. But the reason behind that is that if people can supplement their rehabilitation with specific exercises that are moving them in a direction, it reduces the amount of treatment that they need. So it's generally more economical, and it speeds up the process if they supplement their rehabilitation with a very specific tailor-made program for them, depending on where they're at in between supervised treatment sessions. So that's the main reason why it's done. Without that, it obviously would be a lot more contact on a one-to-one basis. But in general, exercises can be considered as either exercises to promote flexibility and movement. So they're generally stretching kind of motions. So people who need stretching exercises are people whose movement is stiff. And that may be a very generalized stiffness, or may be specific to an area, a knee, a hip, an ankle, a shoulder, or a spine, wherever the case may be. So the prescribed stretching needs to be, first of all, to target the zone that needs to be stretched, first and foremost. And then secondly, it needs to stretch in the direction that's restricted. And very often we see people who've Googled stretches for the spine, and I've done some stretches that they found online, but they don't reflect the direction of movement that they need to get their flexibility in. So that's quite important. If you're looking to achieve something, to change the mechanics of tightness in joints or muscles or ligaments, and the movement is restricted in a certain direction, then unless the stretching that you're doing enhances that direction, then you're really not doing very much. So sometimes that can be hard to identify yourself. It's more obvious in a spinal problem where forward bending is restricted, because that's a movement that you might do very frequently during the day, and day-to-day tasks like putting on your shoes and socks, or getting dressed, or reaching down to the floor. If they feel sore or stiff or uncomfortable, then you have a very clear measure. Sometimes it's not quite as clear as that. So they are clues that flexibility may be part of the problem, and then a specific examination of the regions in question should be able to determine whether there is in fact a restriction of movement, and therefore some indication to do stretching techniques. And then really it comes down to the therapist choosing the best and most appropriate type of stretching to target the particular area that you really need to work on. And that sometimes it's trial and error. There are a list of standardized positions, but it really comes down to what works best for you as an individual. And that really has to be worked out in clinic. The other group of home exercises that people work with are strengthening exercises. And strengthening exercises are really prescribed for a number of reasons. One, if joints are getting irritated because the muscles aren't giving them enough protection. Well, if that's the situation, when you test the muscles, they test weak on examination, and really unless you improve the strength of those areas, the cycle of repetitive joint irritation just keeps going. So that's an important criteria for strengthening. And obviously the measure of strengthening not only is that a particular task gets easier to do, which is a measure that things are improving, but that it has to translate into some improvements in the quality of movement that you're compromised with, whether it's walking, bending, reaching, carrying, whatever the task may be. So there has to be a practical payback for that. Now, sometimes there can be a lag if people's strength is quite compromised, and it does take a matter of weeks or months sometimes to get strength up to speed. But you usually know, if you set out realistic goals and milestones, you usually know if people are working towards those objectives and if they are, there should be some correlation in reduction of pain intensity as they improve. The choice of strengthening exercise is a huge variety. In rehab, we generally try to look for what you would call functional exercises, so movements which replicate how the body is tested or used on a day-to-day basis. So for the weight-bearing joints, that's things in standing, whether that's squatting or lunging or bending or reaching or these kind of day-to-day tasks. Sometimes that is just too much physical pressure, so one has to go for what we might call non-functional exercises, or exercises which isolate individual muscles. And sometimes there's no choice but to do that, but the big issue is that needs to be progressed into the kind of loading that's involved for day-to-day activity. So that's sometimes missed along the way, that people are given post-operative exercises which work fine for a couple of weeks, but they really have served their purpose after a few weeks and need to be moved on to higher levels of function. One of the reasons I bring this up as a topic of conversation today is that we're increasingly seeing more and more patients being given sheets of exercise from either the general practitioner, from the surgeon, or from departments in hospital, and just expected to work their way through a scheme of very generic exercises. And rarely do people need to do all of the exercises that are on a sheet. They're just a general mash of all different combinations of things, which means that either they're spending an inordinate amount of time on an exercise program and usually fall by the wayside pretty quickly, or they can't really judge if anything is particularly helping. I'm much more in favor of fine-tuning an exercise program to 3 or 4 key things. Some of those might be flexibility, some of those may be strength, but 3 or 4 key things that can be done daily, sometimes twice daily, which is a better way of trying to achieve progression rather than a big long list of things that either don't get done or get done in a half-hearted fashion. Probably the most extreme example of this I saw was a 74-year-old lady with a rotator cuff tear who's had it injected a few times, and she came back again for a reassessment about 6 or 8 weeks ago, and had a sheet of 12 pages of shoulder exercise, virtually every shoulder exercise that could possibly be prescribed. And of course, she wasn't physically able to do a large proportion of them. Significant of them weren't relevant for her, but the surgeon had given her these things and not really referred for rehabilitation. So that seems to be an increasing trend, and obviously it does beg the question, when people are given exercises, is it the most specific and best thing that they can do to move themselves forwards? It's very hard for you as an individual to know if you're doing the most specific things. You have to take people on face value. But when you're being given a general sheet of exercises, I would say be a little bit precautionary with that, because that's just something to try and cover everything. It's the McDonald's approach to rehabilitation. It's not really a specific program geared towards your needs. So it's certainly a trend we're seeing more and more of in recent years, and I just thought you needed to be aware of it. I'll see you again in another video. Bye for now.